We don't have any information on it yet. There is information on the web right now of the amount of medication involved in so many shootings over the past, I think it's 15 years, of many of these young people were medicated, and it actually lists the meds and the dates and the amount of people killed, etc. So that is on the web, and I was inundated with a lot of information over the past few weeks as people said it's not just the guns, it's the meds. So you need to talk about that too, and Dr. Reiss is really helping us on that. And one of the issues Dr. Reiss is saying is the insurance companies have really pressured psychiatrists, mental health caregivers to collapse the amount of time spent with the client, with the patient. And therefore, it's very hard to know what's really happening with these people and to really do the correct medication and really help them, because in fact counseling does take time, and we really need to think about that. So is that one of the first suggestions you would make to, say, if you had to talk to Joe Biden, who is coming up with suggestions on how to change this problem, what would you say to him?
I would definitely say we need to rearrange our priorities in terms of what good treatment is. There needs to be time to know people and not just to treat symptoms. And the whole system is working backwards right now.
Mm-hmm. Well, it seems to me, too, that mental health care from insurance company standpoints was sort of the ugly stepchild, in a way, for many years. It was less important. If you broke your leg, then you would get covered. Yet if you have a mental health issue, that was kind of difficult to get covered. You know, do you think we're looking at this differently now?
Well, to some extent we are, but really it's part of the whole society's problem of short-sightedness. We only look at the bottom line for the next few months or the next year. If you really look at it, there's data that a huge percentage of doctors' visits really are mental health visits. People going in with physical symptoms that are part of anxiety or depression that may or may not need treatment, but if we had a good mental health system, we'd actually reduce medical costs. But the insurance companies, the government, aren't looking at, is this going to reduce costs over 5 years? They're looking at, is it going to reduce costs over 6 months? And when they do that, it goes to, well, let's just prescribe something and get the person out. I had contact in California, where I'm based, with the governor's office under Schwarzenegger, and they were very open with me. They said, we're just looking at this year's budget, and they didn't want to hear anything beyond that.
Wow, and you're right. That is a perfect way to put it. This is so short-sighted, and it hurts. Well, so much of our population is hurting, and bottom line, it is mental health issues, you're saying, that actually come out as, we call it, a somatic experience. So you're feeling physical pain, but actually it's your connections, it's your relationships, it's the way you're feeling about your life, and it comes out in your physical body. And so that's what causes these visits. And in fact, a larger percent, you're saying, is that, not actual physical problems. So that's a whole different way to look at it. That's a huge shift, a paradigm shift for all of us.
Right, and it's also something that you see in people who have medical problems or injuries, where the insurance, the doctors are hesitant to send them to psychiatric care, and instead will try to treat it themselves. So the average person I'll see, like through the California workers' comp system, is already on 2 or 3 meds prescribed by maybe an orthopedist. They're already on pain medications. Half of them are using medicinal marijuana, and then they're sent to me on 15 minutes to figure out what's going on. That's a losing proposition, and it's very expensive in the long run, both humanitarian level and at financial level.
I can see that, and I can understand that it doesn't help anybody. It just, again, it's this big medicated Band-Aid over a lot of much bigger, more treatable issues. But this treatment, which is more counseling, tending to emotions, tending to support systems and relationships, it takes more time and possibly more money than a few pills, and we really need to change the way we think about that. And we're really doing a disservice to our youth, and I absolutely believe that this is part of our problem.
Yes, and unfortunately, I think it can get worse because people are growing up with the mindset that you reach for a pill or that emotion shouldn't be tolerated. And obviously, that's also an impetus towards illegal drug use as well as overuse of medications. I shouldn't feel bad. The biggest lie we're told is that so they live happily ever after. You don't live happily ever after. It's all the time you struggle, and that doesn't mean
So that's something for everyone to think about for a second. Listeners, be aware. You know what? Happily ever after is occasional. Happy is good. You can't feel fully happy, though, unless you feel sadness and grief as well. You can't just numb out the sadness and grief, because when you start numbing one emotion, all of them get numb. So
exactly, and that's one of the problems actually with SSRIs, is they tend to numb all emotions. And I have people who like being on them, but because they're not feeling much of anything, that's not really a healthy way to live, and it doesn't help relationships any.
No, that's a horrible way to live. And how can you be available to your partner, to your child, even to the people at work, if you're not really there? You're not who you are. You're not feeling all of the things that you're supposed to feel. So
Yes.
we need to have people learn how to handle their intense emotions, reach for others. I'm all about attachment, so I talk about co-regulation a lot, which is we calm each other down. We don't really necessarily do it alone. And that's another piece of this, is we think that we're supposed to self-soothe and that pill will help us and we're going to be fine, but that's actually not the truth.
And a lot of what I've been talking about since the recent tragedies is also how poorly our society does grief. We do anger and we do revenge, but we really only allow ourselves to grieve briefly for a few days, and that's not the normal process. If you look at every culture, every religion, there was a process of grief, and at times it takes weeks or months. It's not something you get over within a day and go back to work. But that's what we're generally expected to do.
And that's a good point too. And boy, all of us, I think, globally, are feeling the effects of Newtown. It is a small town in Connecticut, very close to my town, and it's emanating. It is still there, the grief, the loss, the sadness, and no, you can't just get over that. And it's okay. It's okay to ask for help. It's okay to admit that you're still sad and you're still down. And that's another message that we have to allow ourselves and our family members in our community, is grieving takes time. And if we say to each other, we understand, we empathize, I can be there for you, and you're not doing this alone, we all get through it.
That's very true. That we're not born knowing how to mourn. We can suffer, but the actual process of mourning takes people around us, takes comforting, takes connection. We need to learn that, and we've lost a lot of the spiritual and religious traditions, and I'm not talking any one specific religious belief, but we've lost a lot of the traditions that have helped us to deal with these feelings. So we're left with these emotions sort of by ourselves and expected to pull it together, and if anything, just get revenge rather than to actually deal with what's going on.
That is a very, very good point, and something that we have to remember, which is many of us don't practice our spiritual traditions as we had in the past as families and communities, and yet you still need it. We have this impulse to grieve in community. It's hard to grieve alone. It's isolating. It's much worse for you, I believe. And many of us are connected to our religious, to our churches or synagogues or whatever, but if you're not, you're going to have to reach out in some community way to grieve, because you can't do it alone, really. So any listeners out there, if you need to find a spiritual practice, allow yourself to grieve. I've had such a good talk with you, Dr. Reiss. I really appreciate it. Dr. Reiss is based in San Diego. You can find him on the net. He has been practicing psychiatry for 25 years, and I really appreciate your words of wisdom and a lot of knowledge there, Dr. Reiss. And we all have a lot to learn, and we have to change our system, that's for sure.
Well, thank you very much. I'm very glad to be here.
All right. Thank you, Dr. Reiss.
Have a good day.
Bye. We'll be right back with Keeping Connected with Trevor Crowe. Stay tuned.